Hello and welcome to our guideline videos for healthcare professionals. In this last part of the series of videos regarding Australian Medical Council, AMC, and Professional and Linguistic Assessment Board, PLAB exam for UK, which has recently changed to United Kingdom Medical Licensing Assessment, UKMLA, or MLA exam. We are going to have an in-depth comparative review for required English proficiency exams, total expenses that may take place on AMC and PLAB, available job opportunities, as well as expected salary structure that you may earn in UK or Australia. So, stay tuned and keep watching this video till the end for this exclusive information. You may also watch part 1 of this series where we covered general overview and eligibility criteria for these two exams. We have provided the link of this video here, as well as in the description section. For more comparative review regarding exams content, passing criteria, how and when to register, and attempts allowed, do not forget to watch part 2 of this series. We have provided the link of this video here, as well as in the description section. This is Dr. Muhammad from Interface Medical Education, and I will try to discuss AMC and PLAB, or UKMLA medical licensing exams in a comparative manner. So keep watching this video till the end. I am sure that you will be able to understand many things related to AMC and PLAB, or UKMLA exam. Before starting this video, we would also like to invite you to watch many of our videos made for healthcare professionals. I will request you guys to subscribe to our channel, hit the bell icon, to enjoy more of such informative videos in future. And of course, if you like this video, then do not hesitate to hit the like button and send us your valuable comments. So, let's get started now. While applying for AMC and PLAB or UKMLA exam, you must prove your English proficiency as a medical professional to be able to practice in the health system of Australia and UK. There are different English proficiency exams available to prove your English speaking, writing, listening, and reading skills. For AMC or PLAB exam, you may either apply to pass OET test, which is an English language test designed to evaluate English proficiency for the healthcare professionals. The test content and structure reflect currently healthcare workplace scenarios and the changing need of the sector. The minimum required score of 350 out of 500 or grade B is required. For IELTS academic version, you must score individual band of 7 in each testing area of speaking, writing, listening, and reading, with an overall score of at least 7.5 for PLAB and overall score of 7 for AMC exam. For AMC specifically, there is another exam by the name of PTE Academic, conducted and organised by Pearson VUE Testing Service. This is a computer-based test that evaluates your academic level speaking, writing, reading and listening skills. You are required to score 65 in each module and 65 in overall test. When we talk about which one of these English proficiency tests is comparatively easy, cost-effective, and having dates and venues availability, IELTS takes more precedence in terms of cost, exam venues and dates than OET and PTE, but specifically for healthcare professionals, OET is simpler to understand because being a healthcare professional you probably already have familiarity with most of the required vocabulary. Whereas, being a healthcare professional, you may find IELTS and PTE a little bit difficult, especially their writing parts. All of these English proficiency exams have 2 years validity. Your AMC or GMC registration should have completed within 2 years of passing any of these tests. AMC exam is significantly more expensive while comparing with PLAB. Let's dig in more step-by-step cost comparison for these two exams. Let's take AMC exam first. Initially, to establish AMC portfolio with single qualification verification by ECFMG will cost you $642 Australian dollars, and for each extra qualification you will be required to pay $107 Australian dollars. Secondly, for Part 1 CAT MCQs examination, it will cost you $3,124 Australian dollars. For Part 2, which can currently be taken online, will cost you $4,391 Australian dollars, and in-person examination taken in Australia will cost you $3,991 Australian dollars in 2024. As far as English proficiency exams are concerned, OET will cost you $587 Australian dollars, and IELTS or PTE academic will cost you $410 Australian dollars each in 2024. Therefore, the total cost may be equal to $8,000 to $9,000 Australian dollars in 2024. whereas for PLAB Part 1 or ACAT exam, the fee will be £268 after April 2024, which is currently £255. For Part 2 or CPSA clinical examination, the fee is £934, which will be increased to £981 after April 2024. As far as English proficiency exams are concerned, OET will cost you £329 and IELTS will cost you £180 to £210 depending upon the test location. Therefore, the total cost may be equal to approximately £1,400 to £1,500. And when you convert it into Australian dollars, you will get approximately 2,900 Australian dollars while comparing PLAB total cost with AMC exam in Australian dollars. Now, this should give you a clear idea that how expensive AMC exam is while comparing it with PLAB exam. After passing even your AMC 1 and landing in Australia, getting your first job is a bit tough these days, especially when you are coming from MBBS route as an international medical graduate, IMG. Dental graduates may get a full-time or part-time job role in Australia with a little bit of struggle. But being tough doesn't mean impossible, because to be able to adjust in any new health system, passing their required licensing exam and meeting other requirements is a part of your journey, but you must have good connection or references in their healthcare system to be able to consider as appropriate candidate. In one of our separate videos, we have discussed such approaches or strategies, helping you find a better job offer. Although this video is related to UAE healthcare job market, but the tips and strategies can equally help you to explore Australian or UK healthcare job market. We have provided the link of this video here, as well as in the description section. Unlike PLAB, you do not need to pass both parts of AMC exam to get a job in Australia. You may opt for any appropriate assessment pathway for yourself, pass your AMC 1 exam, secure a job offer, apply to the Medical Board of Australia for limited registration, complete your 12-month supervised practice in a hospital. After this, you can either opt to pass your AMC 2 clinical examination during this period, or opt for WBA program, which is workplace-based assessment program. On the other hand, after passing AMC 1 CAT examination, you can apply and pass AMC 2 clinical examination, then secure your employment offer, apply for Medical Board of Australia for provisional registration, and lastly on this route, complete your 12-month supervised training. Then you are good to enjoy more facilities in Australian healthcare system. For UK job opportunities in health sector, you should have passed both PLAB 1 and 2, or according to new UKMLA system, you should have passed your ACT as well as CPSA clinical assessment exams and completing your GMC registration. Now, you are good to apply for NHS jobs, but before applying for your job, you must have good understanding about different clinical roles available for you based upon your previous experience in the NHS. Try to apply for the targeted post based upon this graphical presentation. You should always have second plan because of the current saturation in healthcare sector in UK, especially for IMGs. One option is to sit for MSRA exam, which is Multi-Specialty Recruitment Assessment exam. Passing this exam will enable you to enter into certain postgraduate specialty training in UK. In this video, we are not going to cover much of MSRA exam, but if you wish to know more about this exam, then let us know in comment section. We will make a separate video for this exam. Now, coming back to our PLAB job journey, kindly understand when we say job saturation for IMGs. Yes, it is getting more competitive day by day, but the situation is not much bleak when you are searching for right job for you in UK. But it is all about how good you understand UK jobbing application process. It's like what NHS expect you to know and follow. Instead, you keep on applying for jobs considering your limited requirements. Therefore, kindly try to understand NHS jobbing application criteria, broaden your requirements, and understand the requirements of job you are applying for. We bet that you will have positive results within 7 to 9 months. Salary scale beside other benefits plays a significant role while deciding which country to relocate. Doctors in both the UK and Australia are paid well, although on average Australia pays its doctor more, and junior doctors in Australia certainly earn more than their UK counterparts, but that doesn't mean that UK has entirely low salary structure for healthcare professionals. Let's dig in for more competitive details. For a trainee-level UK doctors, especially in foundation training stage, you may earn tentatively from $32,398 to $37,303 per year as basic salary. Whereas in Australia, an intern or first-year resident doctor can tentatively earn from 60,000 to 80,000 Australian dollars annually, which may grow as you gain more experience. In UK, if you are a specialist trainee doctor, then you may expect tentatively basic salary of 43,923 to 63,152 British pounds annually, whereas in Australia, during your training phase for specialisation, you may tentatively expect to earn 100,000 to 150,000 Australian dollars annually. For specialist doctor in UK, the tentatively basic salary is 52,530 to 82,400 British pounds, and for specialist grade doctor, you may expect basic salary of 83,945 to 92,275 British pounds. Whereas being a specialist doctor in Australia, you may tentatively expect to earn 200,000 to 500,000 Australian dollars annually. Consultants in UK enjoy more competitive salary structure, which tentatively ranging from 93,666 to 126,281 British pounds per year, whereas in Australia, a consultant can be earning an average of 310,000 Australian dollars annually. When it comes to GPs in UK, you may have tentative salary structure from 68,975 to 104,085 British pounds per year, whereas GPs in Australia may tentatively earn 150,000 to 300,000 Australian dollars annually, which may increase as your experience grow, especially in private practice. Now, after all these details, Australia does have significant edge as far as doctors' salaries are concerned, but again, there may be many other things you may consider besides salary before relocating to any of these countries. And in the end, the choice is always yours. Please remember that the above defined salary structure may drastically differ at different times. We have collected these figures at the time of creating this video in the start of 2024. That's all from us. Hopefully this video will be beneficial for you and will clarify many of your questions related to many key points for AMC and PLAB or UKMLA exams, especially before relocating to Australia or UK. You may find the links of remaining parts of this video series in the description section. Do not forget to watch many of our videos made for healthcare professionals. Hopefully you may have liked this video. Then do not forget to hit the like button. Share, comment and subscribe to our channel. Have a good day. Bye.